If you're deficient in vitamin D, you're not going to sleep at night. Vitamin D helps the circadian rhythm. It helps the sleep centers in your brain. And that center is called the suprachiasmatic nucleus. So whether you have sleep apnea, or you just have insomnia, or you get up in the middle of the night because you have high cortisol, like at 2 o'clock, vitamin D can greatly help. I mean, in Alzheimer's, Parkinson's, dementia, there's always a vitamin D deficiency. And then we have your mood. Your mood is greatly influenced by vitamin D. Think about in the winter what happens. You have seasonal affective disorder. So if you have anxiety or you're especially depressed, you need to take more vitamin D, and it will definitely raise your mood. If you're deficient in vitamin D, your hair is going to be very dry. It's going to be brittle. You're not going to be able to produce the numbers of hair because the growth of hair is dependent on vitamin D. You may have early graying. You may experience hair loss during stress. That's a certain condition, or hair loss during menopause, or you may develop an autoimmune disease, alopecia. If you're deficient in vitamin D, you'll be more predisposed to getting psoriasis and even eczema on your skin. And so now let's just talk about the skin in general. People that get acne are usually always low in vitamin D. It can decrease inflammation on your skin. It can help prevent vitiligo, where you have this whitening or a lack of pigment on your skin. People with vitiligo are always deficient in vitamin D. If you're low in vitamin D, your risk for getting skin cancer like melanoma goes dramatically up. The sinuses all have receptors for vitamin D in them. And if you're deficient in vitamin D, you can have a stuffy nose, you can have sinusitis. And the reason why the vitamin D is in the nose is to protect you against viruses that are coming in through the nasal passages. The thymus gland, which is right on top of the heart, is the training camp for your T cells. And as you age, your thymus gland shrinks, and so does your immune system. So the thymus gland desperately needs vitamin D to help virtually every part of your immune system. Every part of the immune system has vitamin D receptors. Vitamin D helps control the cytokine storm. It helps control certain autoimmune diseases developing. It helps control the self-attack, which is involved in autoimmune disorders. It's an immune modulator, so it helps buffer an overreactive immune system. That's why it's good for allergies as well. Then we have the eyes, right? If you're susceptible to getting cataracts, vitamin D can help slow down that process. Vitamin D deficiencies are associated with macular degeneration, glaucoma, and especially dry eyes. The most common thyroid condition is Hashimoto's. Like 90% of all hypothyroid type conditions is autoimmune. It's Hashimoto's. And like I said before, vitamin D is the best natural remedy for any autoimmune problem at all because it drops inflammation. And if you didn't have inflammation, when you had any type of autoimmune disease, your complications, the side effects would be very minimal. Graves' disease, both autoimmune, one's a hypo, one's a hyper problem with the thyroid, can greatly benefit from vitamin D. All right, what about the teeth? Well, if you're deficient in vitamin D, you're not going to drive the calcium into the bone, and your teeth are bone made from calcium. And so we need vitamin D to regulate that calcium. And so if you're deficient in vitamin D as a little child, or even when you're a baby inside your mother and you're deficient in this vitamin D, unfortunately, you can develop all sorts of bone malformations later in life or even earlier in life as problems with the maxillary bone. So you have an overbite or an underbite, or you have, you're going to need braces because your teeth are crooked, or you might have missing teeth. But it doesn't just affect your teeth, it affects the entire skeletal system. You're more susceptible to getting scoliosis, which is like an S curve of your spine, or a hunchback, which is kyphosis, or an exaggerated low back curve, which is lordosis, or even flat feet or bowed legs, which is rickets. So all of this can be majorly prevented if that mother gets enough vitamin D early on when she's pregnant, if she's breastfeeding. And so hopefully that child is getting enough vitamin D and other nutrients when they're developing. I think it's the most important action for a woman who's pregnant to get the right nutrients. because if you're just deficient in one vitamin, vitamin D, that child could end up with major skeletal malformations later in life. And it can be totally avoided by making sure that the diet is correct and making sure that those nutrients are high quality and not some synthetic prenatal that comes from petroleum. I remember even as a child growing up, I craved butter. I could eat an entire pound of butter in one sitting. Little did I know what was in that butter. There was vitamin D in there, but there was also vitamin K2. And vitamin K2 works with vitamin D, especially in the formation of the strength of your teeth and your bones, can be improved very quickly in a child if they're out in the sun playing. So vitamin D just helps open up the lungs and asthma. It's great for lung infections, pneumonia, bronchitis, any type of inflammatory condition in your lung. Vitamin D should be at the top of the list. Also, vitamin D keeps viruses in remission and is awesome for things like COPD and even cancer of your lungs. If you don't have enough vitamin D, your muscles are not going to recover after exercise. You're going to get muscle cramps. Why? Because vitamin D helps control calcium, and calcium is involved in the contraction and relaxation of your muscles. And so it might not be an electrolyte that's causing your cramps. It could be the vitamin that helps you absorb one of these electrolytes. And you also need magnesium when you take vitamin D. They both work together. And magnesium is also very important in muscle physiology. I mean, the main hormone on the outer portion of your adrenal glands, which is called the cortex, is cortisol. And cortisol works very similar to vitamin D. They both are powerful anti-inflammatories. They both help your immune system. And if you have high levels of cortisol, you're going to also need more vitamin D. All right, now what about the pancreas? Yes, especially the cells that make insulin, called the islets of Langerhans. These beta cells require vitamin D to make insulin. And if you have an autoimmune disease like in type 1 diabetes, it could have been set up, or your body can be very susceptible to getting that condition if you're low in vitamin D. And if you have the condition, vitamin D is very, very important in keeping inflammation as low as possible. A huge association between coronary heart disease and low vitamin D. Vitamin D helps keep the inflammation low inside your coronary arteries. Also, the topic on high blood pressure. Vitamin D is one of the best things to drop blood pressure. Well, without vitamin D, your risk for insulin resistance goes higher. There's a high association with low vitamin D when you have a fatty liver. You're more susceptible to getting stones if you're low in vitamin D. So many people have irritable bowel syndrome. They have ulcerative colitis. They have Crohn's and diverticulitis. Any inflammation in the gut can be greatly improved with vitamin D. And if that inflammation continues, it creates leaky gut. So there's gaps in the intestine, and then you start developing autoimmune diseases, allergies, and all sorts of sensitivities to certain things, both food and environmental. If you're low in vitamin D, your prostate could enlarge. You can have problems with the ovaries and the testicle, whether you have stiffness, pain, inflammation. You need vitamin D because vitamin D is a natural anti-inflammatory. It gets rid of pain. And it's especially important in all the itises like arthritis, both rheumatoid and osteo. By Dr. Weston Price. Okay. He was a dentist, but he did a lot of research back in the 30s and the 40s. And he visited these remote cultures that ate very, very healthy foods. And he was trying to identify what was it about their diet that generated such amazing teeth. So Weston Price looked at calcium. He looked at the fat-soluble vitamins. Maybe at first he thought it was vitamin D or vitamin A or vitamin E. But at the time, vitamin K2 wasn't identified. And so it was really interesting that he had a term for it called activator X. Kind of like the X factor. There's something in addition to these regular fat-soluble vitamins that is creating really good teeth, like really good bones, good bone structure, and overall good health. He just didn't know about vitamin K2 because it wasn't discovered yet. And so he looked at cultures in the Swiss Alps, and he found that they ate a lot of grass-fed butter and cheese and really, really natural things. And so he identified their teeth being just like really, really good. Fast forward, we know now it's vitamin K2. There's vitamin K1, that's all about clotting. And then there's vitamin K2, which is all about calcium transportation. Vitamin K2 works with vitamin D. Okay. Now, vitamin D helps a person absorb calcium in the intestines by a factor of 20 times. If someone doesn't have enough vitamin D, calcium really won't be absorbed in the blood too well. But vitamin K2 takes it to the next level. It takes the calcium from the blood and it pushes into the bone. And so the way it does this is it activates certain proteins. And another thing that's really interesting about vitamin K2, it uses a transport system called LDL, and then it ends up in your bones. So it makes your bones really, really solid. It helps certain parts of your teeth become very, very strong. It keeps calcium from building up in the arteries. It prevents vascular calcification. It also prevents calcium from ending up in your cartilage or in your joints, as in arthritis, things like that. It activates a very important cell called the beta cell in your pancreas, which makes insulin more sensitive. So if a person has insulin resistance, which the majority of the population has, it can really help someone's blood sugar by improving insulin resistance, because now it's going to make insulin more sensitive. And then your body can make less insulin. It helps generate more ATP or energy in the muscle cell. It also is involved in supporting the cells that make testosterone. It also works on the brain. It improves spatial learning as well as memory. Now, the majority of vitamin K2 comes from bacteria. And so when a cow eats grass that is loaded with vitamin K1, that vitamin K1 changes into vitamin K2 with the help of bacteria. Vitamin K1 and vitamin K2 are fat-soluble vitamins, so it is stored in fat. So if someone goes low fat, or they're on medications that block cholesterol, for example, they may not get enough vitamin K2. The number one food that has the most vitamin K2 is cheese. There is one other food that has more vitamin K2. The number one product is really natto, which is a fermented soybean, which if you ever tasted it, you probably would not like it too much. All of the hard cheeses and the soft cheeses, there's one cheese that it ranks number one, and that is called the Munster cheese, okay, which is grown in the mountains of France, where they create this cheese with raw milk, not the pasteurized milk that they use in the US. Cheese, you have MK4, MK5, you have MK6, MK7, MK8, and also MK9. So you have a huge variety of different versions of this vitamin K2 as compared to some other foods that may only have one version, like maybe MK4 or MK7. But if you can find some raw cheese, that would always be better. Usually European cheese, high quality. Hard cheeses are going to have a little bit more. Soft cheeses will have a little bit less, but you're still going to get a good amount of vitamin K2 in cheese. Now, I just have to say something about those recommendations, the governmental recommendations. First of all, anything related to health that's recommended by the government might not be true. I mean, if you think about it, who is the government? Is there one person? Is there a group? Is there a panel? Are these recommendations slightly biased from various groups that can have influence over these policies? The answer is a big fat yes. We also have grass-fed butter. Butter that is made from cows that ate grains have very little vitamin K2. Why is that? Because grains don't have a lot of K1. Grass has a lot of K1. And that K1 gets converted into the K2. So it's grass-fed, it's grass-finished, or another way to say that is 100% grass-fed. That's what you want to consume as far as the butter and other foods if you want to get more K2. The cool thing about butter is that butter has like great amounts of vitamin A, vitamin E, it has vitamin D, and it has vitamin K2. It's really good for someone that has osteoporosis or osteopenia or osteomalacia or even rickets. These are all problems with the bone. And then you have things like goose liver, duck fat, eel. Yes, eel is loaded with vitamin K2. Beef liver or lamb liver. Liver has vitamin K2. Ground beef, grass-fed hot dogs. I'm not talking about the processed, hot dogs that you would get when you go to a ball game or something like that. I'm talking about like high quality grass-fed, no sugar added, clean hot dogs has vitamin K2. Bacon, I'm not talking about the commercial regular bacon. I'm talking about a higher quality bacon has K2. In fact, out of all the meats, pork has the most vitamin K2, which is interesting. And then you also have like sauerkraut. That's a fermented product that has vitamin K2 with the help of the bacteria. And also cod liver oil is another great thing, especially for children growing up. A woman who is lactating, a child who is growing up should have on a regular basis high quality cheese, unless there's some allergy, and high quality butter and cod liver oil. And not only will that help them avoid getting braces, but it's going to improve their entire health.